Most of you know I consider myself as much a clinician as a teacher, that I still maintain the private practice that my father started over 62 years ago. Since today is about commencement, the beginning of your education, I would like to tell you some lessons I've learned since graduating, what I regard as things my patients have taught me. So what I've learned from my patients, these are 10 or so of things patients have taught me. Actually, there are many more than that, but I only have 50 minutes. Just kidding. Kind of used to that interval, you know. This is no particular order. It's not a top 10 list, so it's not designed to gradually ramp up in excitement, okay? So, number 1, talk less, listen more. You know so much, you might be tempted to jump in with conclusions or advice before you hear the whole story. It's said that if you listen long enough, patients will tell you both what's wrong with them and what's causing it. Yogi Berra, the great philosopher and famous catcher for the New York Yankees, said, "You can hear a lot by listening." He was right. Number 2, they're human, just like you. They can't always live up to your expectations. They will follow your advice as much as they can, but you have to realize they have a lot of distractions, and they struggle with the same things you do: losing weight, exercising as much as they should, managing stress. They need encouragement and coaching, not nagging and judgment. They don't mind you admitting your own frailties as well. They need to know you're not any different from them in many ways. 3, they're complicated. You can't fix everything about them. They don't expect you to. What they really want from you is for you to care, and that you'll do everything you can to help them, even if it means sending them somewhere else. 4, they're more likely to do what you do than what you say to do. This is true of most things in life, starting with childhood. The important message is not the spoken one, it is the lived one. Practice what you preach. Let them know that you get your own spine checked, that you try to be active and eat good foods. Don't always do these things, but you try to make these things true about yourself as much as possible. 5, less is more. The chiropractic adjustment works. Chiropractic works. You don't need to surround it with a lot of bells and whistles and other things to make it seem important. It is a single thing you will do that no other health provider offers. 6, it's okay to expect to be compensated for delivering a valuable service. This was a tough lesson for me to learn. I still struggle with it. In an ideal world, we could just truly serve out of a sense of humanity and have all of our needs met without expecting payment in return. In the real world, we have to support ourselves and our families too. Patients understand this, and they expect to compensate you for your care. They need to. 7, it's okay to let patients show their gratitude for your care in other ways. In my early days, and even now, I'm tempted to say quite appropriately, "I didn't really do anything. Your own body did all of the work. I just helped your inner doctor get the job done." It's okay to accept some of the credit. It took a lot of time and money to get your knowledge and skills. When patients say, "Thank you for getting me back to work," or "My life has changed for the better because you got me out of pain," just say, "You're welcome." Accept their homemade cookies and the last tomatoes from their gardens and their heartfelt hugs and celebrate with them. Sometimes all you have to say is, "That's what I do. That's what I was trained to do, and I'm privileged to be able to help. You're welcome. Now tell others about how you've been helped." 8, it's okay to get involved. It's okay to care. It's okay to have feelings and to share them or to share in them with patients. It's a traditional strength of our profession. It's why patients give their chiropractors such high satisfaction ratings. They appreciate you knowing things about them, their families, their hobbies, their fears, and their dreams. It will help support your care of them in ways that an adjustment can't. Just in the last hour, I had to call a patient with a report on her x-rays taken yesterday. They revealed some abnormalities that will require further testing. There's some suspicions. I understand the uncertainty and fear that sort of message might cause, especially right before the weekend. I feel that concern myself. I empathize with our medical colleagues who have to deal with this more than we do. It never gets easy. And I can forgive them some of their detachment. It's tough. Number 9, always do the right thing, even though it's not the easy thing at the time. In the end, the right thing is the easiest thing. Whether it's insurance, care plans, marketing, merely know that your actions reflect not just on you, but on me and your colleagues as well. And number 10, don't take yourself too darn seriously. I believe Mark Twain said something like that. And it's something to remember. Don't get too full of yourself. It's easy to get a big head when people want to tell you how great you are. Happens every day. I recall once not very long ago when I was in the office taking care of a child, a little girl about 8 years old. I was using language tailored to her understanding. I used age-appropriate cultural references to show her I could relate to her. My metaphors and examples were spot on. I was masterfully getting into her world and giving her the big idea. I was on fire, if you can imagine me being on fire. She just stared at me solemnly and pronounced, "You're weird." Don't take yourself too darn seriously. A child will bring you back to earth every time. Lastly, and I know this is number 11, I apologize. Patients are eager to share their experiences with you in chiropractic if they know how to do it. Give them the ability to tell others what you do. Ask them what it is that they think you do, and set them straight if they don't know clearly. Do this and they will fill your office with referrals. In the last couple of weeks, I got some reminders of this. In one instance, a longtime patient was getting spine x-rays done at a medical facility ordered by her medical physician at my request. She'd had a fall. Medicare wouldn't pay for the films her chiropractor ordered. Not fair, I know, but we got her x-rayed. The patient is in her late 60s, and the x-ray technician, quite out of turn, they're not supposed to do this, was excited to show my patient the pictures, how the discs were all healthy looking, how she had no bone spurs or typical signs of an aging spine. My patient remarked, "Maybe that's because I've been seeing my chiropractor for over 40 years. Nice, right? In the other case, a couple who are also long-term patients returned from a reunion of the husband's old Navy buddies. He's in his 80s, and his wife is around 60. That's a story in itself. Of course, the majority of the conversation at the gathering revolved around illness, medications, operations, health issues. You can only imagine. My patient, at age 82, I believe, maybe it's 84 by now, still works. He drives a semi part-time, takes no medication at all. His wife, who works for a health insurance company, by the way, informed the others that she feels her husband is able to do this because the two of them go to the chiropractor every 3 weeks to get their spines checked. What can you do when they tell you things like that? But thank you. I hope more people start thinking about seeing a chiropractor because of you. Marketing is not necessary when people like this are out there. Finally, and this is not number 12, you've heard me talk a lot about gratitude today, the gratitude your patients will have for your care, the gratitude you, the graduates, have for your loved ones who sacrificed money and, more importantly, time with you in order for you to be here. But I dare say there are few here today more grateful than myself for my life, my family, my career. Just about all of that I owe to Palmer College. My father's teaching here helped support our family. Our practice grew thanks to the skills learned here. As a benefit for his teaching, I received a tuition-free education. I graduated debt-free. Please don't hate me anymore. I met my wife here 32 years ago. Our children benefited from college tuition assistance offered by Palmer. Almost everything I now have, I owe in some way to Palmer College. Early on, I resolved to show my gratitude for my tuition-free education. I studied hard. I didn't take it for granted. I decided to do my absolute best, and I did pretty well. I also decided that I would repay Palmer at least the cost of my tuition. I have done that. In fact, I have repaid my tuition several times over, and I intend to continue. Realistically, most of you graduates can't think of doing that. I couldn't either in today's dollars. But just let me plant the seed of an idea in your minds that someday when loans are repaid, your practice is successful, and your children are independent, you might be able to do something like that too. If you received a scholarship, however small, you might consider repaying that amount to help a future student seeking the same dream. So, let me conclude these brief remarks. I hope they've been brief for you. By offering you my heartiest congratulations, along with all the others who received today. You've come here to learn. You have learned much, and you have learned well. Now go forth to serve many, and serve well. Thank you. Enjoy the rest of this wonderful day.